Hello, Angelo. How are you doing?
I'm doing terrific.
I know you're nervous, right?
I was comfortable. I was hiding there. I was very comfortable.
I understand that. As a professor, I sent him a list of questions, and I thought about adding a reading list, but I decided not to do that. So let me and also added a bonus question just in case. You needed a little help with this, okay? Okay, good. Good, indeed, a pleasure to be able to be here today and to have a dialogue with my colleague. So my first question is that social workers are often exposed to stress through work with their individuals, groups, organizations, and communities, as well as our family and acquaintances. Because if you're a social worker, everybody has a question for you. You can't go to the grocery store, anywhere, there's always a question for you. So through our important work, we sometimes bear the stress of others. We experience vicarious trauma, historical trauma, secondary traumatic stress, compassion fatigue, and burnout. As CEO of NASW, what would you propose as strategies to improve the health and well-being of the social work workforce?
Well, thank you for that question, and thank you for agreeing to be the interviewer. I was really excited when I saw that you were going to be doing this. For me, it's a multi-systemic approach to social worker wellness, healthcare professional wellness. And I came to this, I'd been working in social work in a variety of positions for a number of years, but when I became commissioner, we were really concerned about social worker safety. We get workers who'd be threatened and so forth as they were doing their job, and some were even assaulted. And so we had a really big focus on social worker safety, and then began to think, our focus is too narrow. It should be on wellness. And then we start adding this concept of wellness. And then you start looking at it from a multi-systems approach. It's the worker, the supervisor, the mid-managers, and us as the executive management team. And we came up with this mantra that in order for the children to be protected and nurtured, we need to take care of the families. And in order for the families to do what they need to do, the workers need to treat them right. In order for the workers to treat the families right, the supervisors need to treat them right, and on up. And then we said, in order for me as commissioner to feel that way, I need the cabinet secretary to be taking care of me, and I need the governor to be taking care of me. Now, I didn't tell them that, but that's what I needed.
Okay, thank you so much. I want to throw this question out to the audience early in this conversation. When you think about resilience, how do you frame it? What does, so can anyone share with me what resilience means to you? Yes.
I got it. Resilience means to me honoring our past, being fully present in the moment now, and being able to visualize us in the future.
Thank you. Anyone else? Resilience, yes.
Resilience is the ability not only to bounce back from challenges, but to grow stronger from those challenges.
Okay. All right. Anyone? Yes.
Just building on that, the ability to stretch.
Okay. Okay. There's a hand over there. Yes.
So a little bit similar to Adi's, a definition that comes from the psychiatrist Steve Southwick is bend but not break and bounce back.
Okay. Thank you for sharing that, but I want to have you think about resilience as a negative. Suppose you over-rely on resilience as an intervention, and you assume that the person will bounce back. What if they don't? So we have to be very mindful that while resilience is positive, if we rely upon the person's resilience, we may miss an opportunity to serve them and to help them through the crisis. And in social work, we often see that. Correct, Angelo? As we see people, we just assume that they've had the professional training, and no matter what comes to them, they will be able to bounce back. So the resilience can sometimes work against us.
It's interesting you're saying that, because as I was listening to the different definitions of resilience, the one that came to mind for me is, like waterproofing. Like the feathers on a duck's back, that it includes all those other things about being able to bounce back and bend and not break. But part of it is some waterproofing where some things just roll off your back, and that not everything sticks and connects with you. And with our social workers, when we were working, and this is in the child welfare arena, we were working with our staff around the social worker wellness and safety and addressing these issues of secondary trauma. And we one of the things we said, we're going to be really creative with our EAP benefit. We're going to talk to our EAP managers, and we're going to be able to get some debriefing sessions and have some psychologists and clinical social workers come in and do these sessions. And we're not just going to do them after some horrific domestic violence situation or removal of a child or these kind of things. We're going to do it just kind of routinely so it can get. And so we set these up. No one showed up for them. And we said, what are we doing wrong? And then finally we said, you know what? We have the champions in each office that are sort of the informal leaders. We need to convince them to come. And if they come, then others will. And sure enough, we did that. And the point here is that when we hire folks in the child welfare, these social workers, we expect them to be tough. We expect things to roll off their back. And that's how they come at it. Like when they have a critical incident and you say, are you okay? And I used to, as commissioner, I'd go out to get my car and go to their offices and say, are you okay? They say, yeah, I'm good. And say, well, it's okay not to be good. And then to have that discussion, engage, and just to be proactive. And that there are times, and actually I would model this, there was one week in my career as commissioner, I was on the front page of the Boston Globe 4 days in a row. And I knew on Monday morning it was going to be a bad day because my picture above the fold was bigger than the picture of Tom Brady, and the Patriots had won the game. So I knew it was going to be a bad week. So when I get back to the office on that Friday, because I was in the legislature most of the week answering questions, I said, this is a moment I can demonstrate what I talk about. And so I said to people, said, how are you doing? I said, well, I could use a hug right now, or I could use some really good thoughts or some prayers or whatever. This has been a tough week. And what I was trying to demonstrate for them is, this isn't a moment of weakness, me asking you for help. This is a moment of strength, because we all need those times we can just reach out and be vulnerable.
Thank you. I think the message here, Angelo, is okay not to be good. And that's the answer you usually get. How you doing? I'm fine. I'm fine because I'm supposed to be fine. So thank you for sharing that. My second question relates to the climate today. We're experiencing an upsurge in racism, sexism, and some of the other isms. In that many of the clients that we serve are the targets of these isms. How do you believe that creates or adds stress to our profession? Particularly as an African American.
Ask me an easy question. I actually,
as an African American male, I really want to hear.
I think obviously my experience as African American male is different from other African American males' experience. So I don't represent, but I can tell you, I internalize inferiority complex, and I'm a product of the '60s. And during the '70s, and I was sort of, white people are better than us. And it was kind of, what was sort of, I internalized that. And I was in the 7th grade and I was in science class, and I was in a school was predominantly, I went from living in a predominantly black community to living in a predominantly white community. And it was only me and 2 other African Americans that were in the cohort. And so I'm in 7th grade science class thinking these other students are better than me. I said, but maybe not Jimmy. Little Jimmy, he might not be smarter than me. He might not be better than me. He struggles. And lo and behold, I was salutatorian of the class. And so I had to challenge that, well, where does this inferiority complex come from? What is it about? And I had to do a lot of cognitive reframing to, that no one's better than the next one. There's no less than, better than. And so we kind of carry those into our professional work. And when there's these issues of these, things that are coming up, it significantly impacts a professional of color. I can share a story where I became commissioner, was working with the black mental health providers in Massachusetts, and I was proudly announced to them that it's going to be a level playing field going forward in terms of who gets contracts and who gets referrals. They said, we're not interested in a level playing field. It's our turn at the trough. And I said, no, it's not your turn. We're not going to take the tools of the oppressor and then we're going to make it a level playing field. But, they challenged me on that. But for the person of color, you want to do right by your community. And sometimes you put added stress on yourself to do right by your community. And when these threats start happening, you get very concerned and anxious about what's going to happen to our community and what can I do, and you don't want to feel powerless.
Thank you for sharing that. And particularly if we think about the tools of the oppressor and, how do you manage those tools? This year has been particularly difficult. And so my students at Howard have struggled with some of the racism, sexism, Islamophobia, all those things that are out there. So one of the things we did is we said, let's have a positive T-shirt day. So every student, every faculty member, all staff, let's wear a T-shirt with a positive message. So sometimes we have to be proactive, not only reactive, as we begin to sort of think about how we address this. With the Me Too campaign, these are isms that really do impact us, and we really have to think about how do we prepare social workers to deal with their own feelings about this, as well as help the clients through this. So another question. Are there specific tools that are offered by the National Association of Social Workers to help our members as they're dealing with some of these daily struggles, with the isms, with the stress? How do you prepare your members like myself to address this?
Another easy question. There's so many things. It starts even with our code of ethics. I mean, there's the responsibility in code of ethics to self-care. There's a responsibility to practice competently. And if you're competent in what you're doing, you're going to get good results, and you're going to feel good about the work you're doing. If you're not competent, the results won't be as good. And we have professional standards. I started to bring 3 of our latest publications as exhibits. We have a lot on self-care. And then we encourage people to connect and network. And then we try to address issues of salary, of respect and feeling valued, because those things can erode your sense of wellness as well.
Okay, thank you. What do you do with your workforce in terms of, or is there any flexibility that you recommend in terms of work schedules? So are there other things that you think about doing to help to eliminate some of the stress?
I used to tell staff that, we're going to have a practice model that makes sense, and that would really make them nervous because, what's your definition of make sense? And it's like, we're going to do things that make sense, and we're going to sort through it. We don't necessarily have the blue ribbon print on it. But, one of the things we did is make sure that all of our staff have a laptop to where they can work from home when need be, or they don't have to be on the road when the conditions are bad. Then we implemented a telework situation where some staff work from home 2 days or 3 days a week. And then we implemented something called a compressed week or something. You'd work 9 days in a pay period and you get paid for 10. But although you don't get paid for 10, you still do the hours, but you can kind of have some flexibility and trying to be flexible. We try to demonstrate caring. And sometimes that can be very difficult. At one point in my career, we had to have a discussion with staff about caring doesn't mean equalness. Caring means we try to individualize the flexibility because each person needs different level of flexibility.
Thank you so much. And I'll end with one of the things we find helpful at the School of Social Work at Howard is to check in on somebody every day. Just check in. It's not just how you're doing. It is taking a minute to see exactly how you're doing. So thank you so much. You did receive an A, by the way.
Oh.